loss and make sure.
Hello and welcome into this week's edition of AFMC TV. I'm your host, Michelle Rupp. Joining me this morning is Dr. Chad Rodgers. Hi, Dr. Chad. How are you?
I'm doing well. Thanks. Nice to see you again.
Good to see you too. So we are going to discuss a topic. I know you and I have talked about this offline a couple of times. We are talking about hair loss. It seems like we are hearing a lot of people here recently talking about their hair falling out. So probably my first question is, I would assume this is natural, that through the course of our lives, we shed hair.
We do. You know, if you think about it, you have hundreds of thousands of hairs on your head, and it's sort of natural to lose anywhere from 50 to 100 hairs from your head a day. So, I think often when people notice it the most is, when they've just brushed their hair and they looked in and they're like, oh my gosh, or, in the shower drain, just seeing the hair. And it's very common to shed hair, but there are times when you can lose more hair because of different events. And it's not necessarily always something harmful, but it's very distressing to people. It's a question I get asked about a lot.
Sure. So what could be some of those causes? I think typically when we think about hair loss, we might think that as a reaction of like a medical treatment.
Mhm.
But if that's not something that you're experiencing, what could be some of those causes? Stress, maybe?
Yeah. So there's lots of different patterns of hair loss. And, so there's the good old hair loss as we get older, men have receding hairlines and get bald patches. And, this is sort of part of aging. Sometimes women, as they get older, will have some thinning as well. There's also, things where you can go through periods where you'll just lose a bunch of hair. So hair follicles kind of rotate about every 3 months. They go from resting to growing phases, and then they'll, hang around a while. So say a lot of people, if they've had a particularly stressful event, and that could even be an emotionally stressful event, or they had a surgery in pediatrics, what I hear most often from mothers is right after delivery, so delivery itself. There are some medications that may be related to increased hair loss, that you should ask your physician about. But there's also other, causes that may be related to maybe even being real anemic or your thyroid isn't functioning well. So there's some hormonal causes of hair loss.
You touched on it briefly. If we are experiencing hair loss, who do we talk to? Do we talk to our primary care? Do we talk to a dermatologist? Who do we go to?
Yeah, I always think, your primary care doctor is a good place to start because it is a fairly common thing. And, just kind of rule out anything that might be medically wrong. They may want to do a screening, blood work, to make sure you're not anemic and make sure your thyroid is doing well. Also, it will give the physician an opportunity to look at the hair and the pattern of hair loss and determine if it's just kind of this shedding of hair due to some stressful event. Or is it something that's autoimmune, like alopecia, where they get circles of hair loss? Or it might even be an infectious cause of hair loss, like ringworm on the scalp, where you get these round, scaly patches of hair loss. And so those are treatable things that you can start with your primary physician. The other thing, most primary care physicians will feel pretty comfortable prescribing some of these medications that help lessen the rate of hair loss or maybe even promote new growth. So starting with your primary care doctor is a good start. I think if you're not having success or you're having patches of hair that aren't growing back, then that time might be the time you really want to talk to your dermatologist. Dermatology would not be a bad place to start either, though. If your insurance allows you to go directly to the dermatologist, they deal with this all the time as well.
And we are seeing, not in all COVID survivors, but some who have had coronavirus, there have been reports that they are losing some of their hair as well, too.
Right. It's been a really common thing that we're kind of seeing. And so usually about 3 months after COVID, people really start, even in 2 months into it, they start notice sort of an increased hair thinning and hair loss. You just bring wonder how you have a single hair on your head because you look at your brush and you're like, where did all this hair come from? So usually that kind of stabilizes around 3 months, but it may take another 3 months or so for that hair to kind of come back and get thicker. And so that's been real true with COVID infections. Also, with things like surgery and pregnancy, it usually takes about 3 to 6 months before your hair starts to thicken back up to where it was before.
Anything we can do in the interim to strengthen our hair?
Yeah, so there's a lot of things you can do. One thing is just remember, anytime you kind of put tension on your hair, you're increasing that hair wanting to be pulled out of the follicle. So being really careful with really super tight ponytails or buns, anything that puts a lot of tension. The things that you use to hold your hair back, like rubber bands, pull a lot. So you really want to use a proper hair a tie in order to prevent that. The other thing is, a lot of people, when they get their weave, they get very tight braids. That puts a lot of tension on the hair follicle, and you'll see a lot of inflammation sometimes and some hair loss. So just being careful about not putting a lot of stress on your hair when you're brushing your hair. Don't just like rake it, where do small ends. You don't want to pull real hard. That will decrease your rate of hair loss. A lot of shampoos available over the counter that can some that contain minoxidil that kind of can help stimulate hair growth. There's biotin in some of those shampoos, and there's also biotin supplements that you can take, or you can even talk to your physician about biotin injections if you're really having a lot of hair loss.
And then don't panic when it starts to grow back. It will grow back.
Right. But I think that's the main thing, reassurance. Within 3 months and stuff, you should start to see kind of little new squiggly hair growth, and you should start to feel fuller. So,
Good deal. Well, Dr. Chad, is there anything else that you'd like to add today on this topic?
yeah, I think the main thing is just to reassure people that it is common, that many of these things are addressable either with over-the-counter treatments or with supplements, or even with prescriptions to kind of help reduce the rate of hair loss. Some hair loss, unfortunately, is permanently, especially as we get older. But some hair loss have, like the where you lose patches. Some of those things have treatments that you can talk to either your primary care doctor or dermatologist about. So don't be too alarmed. It will grow back.
Great advice. Dr. Chad, thank you for joining us.
All right, no problem.
Joining me now is Stacey George. She is an APRN and works with us here at AFMC. Stacey, thank you for joining us this morning.
Thanks for having me, Michelle.
So we want to talk about colorectal cancer. This was new to me in terms of March is Colorectal Cancer Awareness Month. So let's first start by just at the beginning. Why do you think people are reluctant to get this type of screening? We hear about cancer screenings all the time, but we don't hear as much about this cancer screening.
Absolutely, Michelle. And colorectal cancer is one of the most treatable forms of cancer. So we want to definitely bring awareness to that. And that's why we're focusing on it again in March. Patients are reluctant for many reasons. We hear because the stool-based test or those at-home tests that you do, they're messy, or they're worried they're going to do it incorrectly and not submit a good test and get a false reading or maybe even a false positive. Other reasons are the most common type of screening is a colonoscopy, and they have to take off work for that. Sometimes they have to take off for a prep visit, or the dreaded prep of just getting your body ready for a colonoscopy is reason enough for some people just to completely decline the screening.
What have we seen in terms of have we seen a rise in this particular form of cancer?
Absolutely. Colorectal cancer is actually nationwide the third most common type of cancer. It is
Wow.
also similar to that here in Arkansas. In Arkansas, for men, it's the second common type of death from cancer, second highest cancer death. And for women, it's the third highest cancer death in Arkansas. And that's why we're focusing on it with this work with UAMS.
You mentioned about a partnership with UAMS. Go ahead and tell us about that.
Sure. AFMC is partnered with Uams on something called Partnerships in Colorectal Cancer in Arkansas, and it is to bring awareness to colorectal cancer screening. It's from a CDC grant that Uams was awarded. It's a 5-year program, and we have partnered with a healthcare system in Northeast Arkansas that has 6 clinics that takes care of some of the rural, underserved communities in our state that have higher rates of colorectal cancer and lower rates of screening. So that is where we are focused on our work.
So let's talk about symptoms. How would someone even know that they might even want to get screened? Because even as you said, the screenings don't sound very pleasant. And so that might not, be something that you would want to do unless you were exhibiting some symptoms. What are some of those symptoms?
Absolutely. So rectal bleeding is one of the most common symptoms, or blood in their stool. Change in bathroom habits. So changing from diarrhea to constipation. Sometimes patients have cramping or pain in their lower abdomen. Also anemia, unexplained anemia or low blood count can also be attributed to colorectal cancer.
Is there a specific age group that we're talking about here, a range?
Yes, actually, the range just got lowered, and last year to age 45 is when we talk about screening our patients that are of average risk. And so that brings me to something else I wanted to talk about, the difference of average risk versus high risk. So an average risk person is someone who has no family history of colorectal cancer or no concerning polyps on a previous exam, where a person with high risk is someone with a first degree relative, so a parent, a sibling, a child with colorectal cancer or the concerning polyps.
Okay. And that age of 45, is that both in men and women?
It is. It's for both men and women of average risk. Now,
Okay.
patients that are high risk, we recommend them be screened beginning at age 40, or if they had a family member who had colorectal cancer 10 years earlier than the age that family member was diagnosed. So if their family member was diagnosed at 45, they need to be screened at 35.
Mm-hmm. Mm-hmm. Any other risk factors that might play into this?
Sure, there are different rates like ethnicity. We do see a higher rate in African American population, so that is something that we see. Of course, we see it more commonly in men than women.
Yeah. Okay. And that family history, I mean, we hear it time after time how it's so important to know your family history, and this is another example.
Absolutely, absolutely.
Well, if people have questions or they want to learn more, where can they get more information?
Sure, they can reach out to UAMS. Will have information that we can share with you on the contact for that, or they can reach out to me here at AFMC at sgeorge@afmc.org.
Fantastic. All right, Stacey, thank you so much for joining us today.
All right, thanks, Michelle. Have a great day.
Thank you. And thank you for joining us. We'll see you back here next week for more AFMC TV.